Coronavirus that without a doubt has caused unparalleled health crisis with a ripple effect on global economy, diplomatic tough wars, among other facets of human life world over. Sustained human behavior has had to change. In the public lexicon are words and concepts like social distancing, PPEs, quarantine, among others. To underline and understand this problem further, today we set out to the lakeside county of Rachonyo North, specifically in Kanyafua. Quite a mouthful, but wait, there is more. Ruth Ombura is a nominated MCA in the County Assembly of Homa Bay. Her visit to Sweden on official duty dealt a blow as the entire delegation had to jet back to the country. She's just an illustrious example of government officials and possibly thousands of Kenyans who had to fly back as soon as they could. In the lead up to self-quarantine, what happened to you? Traveled abroad? Yeah. What was the assignment?
Yeah.
How did you get back?
Fine, we went for a training in Stockholm by International Center for Local Democracy that is funded by CEDA. As a county, we were 3 of us from Homa Bay County, but we also had others from both Kiambu and Machakos County and other 7 African countries. So the training was to last 3 weeks. Unfortunately, due to the news of COVID-19 that spread all over, stuck the whole world, we had to cut short our training and left on the 19th. So we traveled, we started our journey back from the 19th and arrived in Kenya on the 20th of March.
She recollects that the problem got more acute and the government of Sweden acted with speed to contain the virus, much as it was not as dreaded as it is today. At any rate, this problem is continually, sweeping Europe.
Yes.
I mean, it's getting graver day by day, but we hope it subsides. But it's been widely reported that there was a lot of ignorance in Europe, and as somebody who's had a privilege to confirm this from both ends, what kind of strategies were deployed or not deployed in Europe that got them to where they are today?
Okay, I must say that when this thing began, it was believed to be the Chinese problem. They never had the scope that it would go beyond the Chinese. We got, for the very first time, the plane that has a capacity of 1,200 people on board. We were about 400 of us. That one already clicked that there was something. That was a signal that something was not proper. But I also must remember that the airlines, that is the KLM, that is the Dutch airline, were already aware of the serious consequences of being insensitive to this virus. So what they did, they fumigated the aircraft before we boarded, and at a place we were forced to stay outside after checking in for about 1 hour in the cold to wait for the fumigation to be done in the aircraft. However, when we got in, they had the word, even though they never believed in it. I can remember inside the aircraft, we were able to sanitize 4 times, which was something very, very unusual.
Today, she's not worn a pensive face, but rather that of glamour, shining with beams of hope. And she knows by heart that it took the favor of God to have tested negative, and she's clearly grateful. Ruth opens up on the exercise of sample taking for purposes of testing, a pain she says is comparable to no other.
What I felt was very uncomfortable was the process of testing. But I had to take it because I also wanted to dismay the fears that probably was along, the stigmatization and all that. So I want all the fears. I think it was good for them to test me so that they give a positive part of it. Because from the normal view, if you looked at me, I had no signs at all. But what could make them ascertain that I was either positive or negative was the test. So I took the courage and asked them to test.
And then later on you cleared?
Yes, they took the samples on Wednesday.
Then the report got
The report was today at around 1. They called me and said, Ruth, how are you? I told them I'm doing well. Do you know who is calling? Of course I know because I had their number. They tell me, you have good news. Your tests have tested negative. So you are free Then I said, oh, to God be all the glory. So I'm very happy that at least now issues of stigmatization, issues of I being locked within the home, I think they are now no more. Otherwise, I'll still have to stay indoors because that is the government directive. Yes.
All right. However, she admits that there was no option riding on the need to protect her family and indeed the beloved Kenyan community.
So I told them I'm coming for self-quarantine, and I asked them to prepare for me a room where I could be all alone. So when we arrived home, definitely I was taken to that room. I saw my people when I arrived outside at a distance. Though it pained me a lot, but I had just to take that responsibility for their life. So I went into my room, and I want to tell you, Alan, that it is very, very difficult to be separated from the people whom you love. And it is also very sad to see the people you love from a distance. And that is all. So that when you want to talk, you either make a call or talk through messages. It was very, very uncomfortable to me.
And sometimes negative reports on her conditions ran around. A situation she says was exacerbated by stigma and misinformation around COVID-19. Ruth notes that all was important to be able to allay fears, and I ask for advice for those who've been directed to self-quarantine. Even as we get to the tail end of this, I just want you to speak to somebody who probably thinks that this is such a difficult experience for anybody who's been directed. For any person who's been directed to self-quarantine, what advice would you give to such a person, especially if they're thinking it's going to be such a devastating experience for them?
To any person who has been advised to self-quarantine, it is very, very important to self-quarantine because that is your life at stake and the lives of the people whom you interact with. Just imagine a family whereby one has failed to quarantine, thinking that he or she is healthy, then in the